this afternoon's Night's Watch discussion on the skeleton key. So we will need for folks to speak up, but where would you like to start?
Carolyn?
Mm-hmm. What did you say?
I think after her father passed away, she took it as a responsibility, and every patient that she has a sense of guilt because of her father, and she's associating all of her patients personally with him. That's why she takes everything so personally, and she has no sense of boundaries. It's not like ethical, I would say, as a nurse. She's really trying to push it slightly. She's trying to find out everything she can. That's not really in her job description. I think it's because she compares every patient she has with her father.
Okay. So maybe upon, and I don't know this, but maybe upon her father's death, she has a sense of abandonment, and maybe as a result of that, her superego will not allow her to have that impulse come to conscious awareness. We have a superego that does not allow this impulse to basically enter Caroline's consciousness, yet the impulse is going to exist, and the net result of that friction is called what? Anxiety, right? So we could actually begin to discuss the skeleton key as a fictional case of an anxiety disorder if we were to remain Freudian and want to go down that path. Whether we come up with a diagnostic label or not, one of the things that we might offer Carolyn is that psychotherapy is likely to be helpful, because psychotherapy allows one to consciously experience one's unconscious. So we resolve issues that result in anxiety through psychotherapy, right? That would be the number one referral here. In psychotherapy, we might identify that her current defense mechanisms are maladaptive, and we would want her to maybe adopt more adaptive, flexible defenses so that the anxiety can be alleviated. The idea is that the role of the ego primarily is to alleviate anxiety caused by the friction between one's id and superego. Her choice of work, her move to Louisiana, and everything she does for Ben is likely a maladaptive defense mechanism called what? So all I did was basically ask the question of why is she doing the very thing that you identified her as doing?
Displacement.
Altruism. Yeah. Now, I think there's a clinical pearl here, one you're not going to see on exams, but I guarantee you is a big-time clinical pearl. It actually came up yesterday's Q&A, and that is the original classification of defense mechanisms was along the lines of what is narcissistic versus immature versus mature, right? And that's George Valiant. And for test-taking purposes, please memorize those lists and get them right on your exam. Not so much the shelf exam, but other exams. In clinical practice, very little regard is provided, is really given to those original classifications. Now we're looking at adaptive defenses that alleviate anxiety and maladaptive defense mechanisms that pose a risk for developing anxiety. So even altruism, which per Valiant is considered to be mature, we could see in Carolyn's case that it's actually maladaptive and is causing clinically significant distress and impairment in her functioning, right? To the point where, spoilers, she dies, right? Altruism and psychotherapy referral, right? So that's one way of looking at Caroline's case. Anything else with this patient/nurse?
Well, I was wondering, based off what you were saying, it kind of sounds more like a transference, counter-transference type of scenario, I guess, is what you were describing to me. Mm-hmm. Where she's letting the patient, because I guess if she's the healthcare provider, it's counter-transference.
Those feelings that Caroline likely has and is experiencing in relation to Ben is probably counter-transference, yeah. Okay. Right. And the other defense that I think you mentioned is displacement here, right? So I think her choice of vocation is largely a product of altruism. I think her interaction, that is with Ben in particular, is largely one of displacement, during which time she experiences feelings consistent with countertransference, right? Countertransference is just the different feelings that a healthcare provider, a clinician, a counselor feels as a result of their patient's transference.
I'm not sure what I think of this exactly, but also they said that hoodoo was something that is psychological, that it only affects you if you believe in it. And I don't know what exactly, but I feel like that's relevant somehow towards something for her.
Yeah, and by and large, it's true, right? And the way and this does come out in shelf exams, so I'm going to state this carefully. The way it's usually or it usually appears on exams is twofold. Number one is there's a 50-50 chance that the question stem is going to ask for the specific name, the label of the culturally sanctioned behavior and or the culturally bound syndrome. In this case, we're talking about a culturally sanctioned behavior. If this is described, if the movie's plot is described in a case vignette on a shelf exam, hoodoo or root work, those are interchangeable, would be your single best answer. So you do need to be able to identify the behavior. In this case, the culturally sanctioned behavior of hoodoo or root work, right? On the other hand, there's another 50% chance that the question stem skips right over that and asks, what is the next best step? And from a physician or a third-year medical student taking their shelf exams perspective, the answer is do nothing. Reassure a patient this is completely normal in the context of their culturally sanctioned norm, right? Nothing further to do, right? And that's hoodoo or root work. So, and where you see this is when a patient like Caroline, well, we can't really use her, so we'll say Virginia, is in the Bayou region of our Delta, the Louisiana Delta, gets on a plane, lands at Newark Liberty, and puts brick dust down in Terminal A, right? TSA is going to apprehend her and is going to escort her, transfer her directly to acute psychiatric services for urgent psychiatric evaluation, and now you're on call, right? As one of my residents, you give me a call at 3 o'clock in the morning and say, hey, Dr. T, here's the HPI, and I'm going to always ask, and I ask my residents all the time, what do you want to do now? And after discovering that the behavior that was manifest in Terminal A is consistent with their culturally sanctioned beliefs in Louisiana, and any patient from that area, it's completely normal, and therefore there's nothing further to do. She will, unfortunately, be discharged to the custody of TSA. She's probably in some trouble with the law, but as far as any medical intervention, psychiatric intervention, nothing further to do, right? So that's culturally sanctioned behavior. Okay. We'll talk a little bit more about this case, but I also want to kind of fold in the idea of culturally bound syndromes too, because they will also appear on your exam. We learned about a couple of them this morning, and this is probably a good time to bring them back up to compare and contrast that which is culturally sanctioned versus that which is culturally bound, right? So, but in a little bit, we'll get to that. But first, let's get back to either Caroline or other characters in the Skeleton Key.
I don't have like a specific psychiatric diagnosis, but with Ben, I was just thinking about like the psychological concept of like learned helplessness. Because, well, yeah, if we're forgetting the magic part, and like he was able to move, and like I know a little bit, I did my neuro, like he didn't have a stroke. He didn't have stroke symptoms, so he was able to move. So, and I guess he did try to escape, but there was just a weird, like he kind of accepted he was half accepting his fate and then half like learned helplessness, like didn't try to escape sometimes. I don't know. It was a mixture.
Yeah, I'd have to know from Ben, those times where we just saw him lying there, to what extent was he physical and capable of moving due to whatever was going on? Call it a poison, call it whatever you want to call it magic, call it root work. versus times where he wasn't physiologically compromised but decided he's staying put anyway.
Yeah.
Because in those instances, we can talk about learned helplessness, right? We would not expect someone who is experiencing learned helplessness to actually try to crawl out of a window and over a roof to escape. So we definitely want to ask him what's going on there. Okay. Learned helplessness is a ideology, a proposed ideology for what? What's it a risk factor for?
Chapter 4.
Yeah, depressive
Like,
disorders.
oh.
Depressive. People who are in situations and environments in which no matter what they do, it's going to be the same outcome, or their expectation is the same outcome, come to realize that they really don't have any control over their environment, and they can become severely depressed. Right? That's learned helplessness. I think it's Bandura, right? Again, the idea that Ben may be experiencing learned helplessness means that Ben also might be depressed. And I think along those lines, it does allow us to look at, as a metaphor, whether or not we have a patient with a stroke syndrome, with maybe even dementia due to vascular disease, with co-occurring depression, right? I got a little bit beyond the scope of our discussion today, but that's a consideration here. I think after we investigate further and realize there might be other stuff going on here, we'd rule that out, including an MRI that's clear or a CT scan that's clear.
He does seem very much like he has no more will to like try for this. He did, as much as I remember, I think he fell off of the roof on purpose. Like he looked at her or something, and he knew what he was doing, and he also had these like weird, not seizures, but he was when he saw the mirror, also he acted up a little bit. I don't know if that was like a ploy to like trap her or something, but he did get, even when she did the little hoodoo magic and then he started talking about it too, he just like starts shaking and like panicking in some sort of way.
Mm-hmm.
So
he does like express his like fear and how he wants, like he asks Caroline for help and like to help him get out, basically like begging her. And he also, I think she asks him like, what are you scared of? And he points like at the door, and his wife Violet was behind the door, so he's kind of like expressing that he has that fear and that he wants to escape.
I agree. I think Ben also, and this might serve, again, as a bit of ideology to what everybody's describing. He allows us for a review of the Ericksonian psychosocial stage theory of personality development. Right? We won't go all the way back to childhood, but if we start at midlife, right? So mid-adulthood or young adulthood, what is the conflict that Erik Erikson says we universally experience? So even if we take a step back, young adulthood would be intimacy, right, versus isolation. Then middle adulthood would be generativity versus stagnation. And I think Ben's chronological age would be there, right? So this is a guy who should be looking at generativity and what he's contributing to society and what legacy he is building. Given all the prior stages of development, right? Instead, he is made to fast forward to the 8th and final stage in a matter of minutes. Right? So he doesn't get the decade plus that we all get to resolve this crisis. Instead, he gets no time whatsoever. Overnight, he is transformed into a very elderly man who is now at the ego integrity stage versus despair. There's no way he's going to resolve the crisis, the conflict of ego integrity. He's not ready to leave this earth. He's not at peace with regard to leaving this earth the way he has and the contributions he's made to it, because he's only like 50. So with that, we have despair. So that's another reason why we may see somebody who appears to be depressed. Right? So it connects nice with learned helplessness. an etiology of depression. And then if we just kind of fold in the Ericksonian theory, we have somebody who is chronologically at the age of being at that 7th stage, which is generativity, but forced to actually address ego integrity, and he's simply not ready for it.
And compared to his wife, I remember her name, Victoria, Violet. She's also very controlling, and she doesn't seem like she cares about Ben at all. There was a line that she said, something me, and then a lot of her sentences were like that, like it's gonna affect me. So I think she's very like narcissistic in some sort of way, and very, very controlling and overbearing, that I can understand why Ben would, like, it's not like a normal fear of your wife. It's like he was actually scared. Like he went into this, I don't want to say catatonic, but he like paralyzed himself basically because of his fear of her.
I agree, and also when Caroline like questions her and questions the whole situation, she becomes really defensive and angry. And at one point, she says, "He's my husband, I'm his wife, and I'll do whatever I wish to do," which I thought was interesting, and that just kind of really shows her controlling tendencies. And also, you mentioned like before something about like possible poison or whatever. And I thought that was interesting because there was one point where when he was having like I think one of his like episodes, I guess, where he was like moving around and basically not just laying there. His wife said something along the lines of like, we have to double his remedies, and it's like she doesn't go the kind of medical route. It's more the like that kind of thing. So
Even during the wheelchairs.
yeah, so she seems like very controlling and wanting to keep him in that state where she can maintain control.
She also was like, no hospital,
Yeah.
just get the wheelchair, we'll see this tomorrow. And yeah, she just seems very also antisocial. Like she does not want anyone. I think the only person who she probably interacts with is the lawyer. But I don't, apparently she sent back 5 nurses before this,
Yeah.
so.
So, just to flip over to the supernatural side, everybody here is aware of the fact that that's not his real wife, right? Okay, because the way you were talking about her, you're talking about some kind of discord, but the fact is that's not his wife. Violet's husband is the young lawyer, right? Yeah, okay, I just want to make sure everybody got that. Right? And the reason why she sent back all those nurses was why?
Because they were not the right person
Yeah.
to.
He wasn't attracted to her. Right? He wanted somebody that was a blonde. Yeah, it's as superficial as it was. And then they found someone, and they just needed now to convince her that everything was real. And as soon as she believed, she was vulnerable and victimized. Right? All right, let's jump to some ideas of culturally bound syndromes. First, again, on shelf exams, it's almost a guarantee. You're going to have to identify, foundationally, you're going to need to know and understand how a culturally bound syndrome and a culturally sanctioned belief are similar. So what is the shared similarity? Culturally bound syndrome and culturally sanctioned beliefs. Okay. With,
Perfectly, like it's in a particular bound by its geographical location.
right? So these conditions, both conditions, are thought to be geographically isolated. Right now, 2025, it's less and less likely, but boy, we can create a very, very artificial environment on a shelf exam. So in both cases, we have behaviors that are geographically isolated. And if that is the case, and that's going to be the case in the first sentence or two, what will, beginning with sentence 3, what will be needed to differentiate one from the other?
For the sanctioned behavior, it would be like normal for the culture, and for the syndrome, it would be something that's abnormal.
Everybody got that? Right? Culturally sanctioned behaviors, with the focus on the word sanctioned, are sanctioned or normal for that particular geographical region. On the other hand, despite the fact that it is geographically isolated, culturally bound syndromes' focus of attention on the word syndrome is considered to be abnormal within the culture. right? So while hoodoo is a culturally sanctioned belief, we should talk now about some culturally bound syndromes that are likely to appear on a shelf exam. So what examples do we got? Arctic hysteria, Pigolocto, which is what we touched on this morning, right? When people who reside above the Arctic Circle have or spontaneously run into the snow, freezing temperatures, sometimes naked, and bury their faces in the snow, yelling and screaming, right? No idea why Auntie just did that, but there she goes, boom, head in the snow. Tor describes that, living with the natives. North of the Arctic Circle, that's Pigolocto, that is Arctic hysteria. It is localized to that area. We don't see Pigolocto south of the Arctic Circle. And within that area, it's considered to be abnormal. Other examples. Anorexia is one that is considered to be culturally bound as well outside of the United States. It is virtually non-existent with regard to a point prevalence. It approaches 2 in the U.S. Even among other industrialized nations, Great Britain, the point prevalence is less than 0.5%. So from the rest of the world's perspective, anorexia nervosa, culturally bound to the United States. Amok, A-M-O-K, amok, right? So with no prior history of violence, an individual will go on a quote-unquote frenzy, sometimes even grabbing a gun and look to harm people, right? I want to say the episode is The Old Man, and that is Seinfeld, and it's actually discussed in Seinfeld with, of all people, a mail carrier, Newman, right? The term going postal is the U.S. equivalent to amok, which also, that is amok, appears in The Shining as well, right? When Jack Torrance interviews with Ullman at the beginning of the movie, Mr. Ullman describes the former caretaker, that's Charles Grady, as having run amok, A-M-O-K. Yep.
And dot, like D-H-A-T?
Dot, yep. So what's the dot syndrome, D-H-A-T?
Wasn't that the insemination one?
All right, so what happens?
Something about male semen.
Yeah. Males become preoccupied and even delusional about losing their semen through their urine and becoming infertile. The dot syndrome.
And there was like a Latin one, I think. Ojo thing, something.
Maldiocchio?
I can't say these words.
the evil eye, right? Maldiocchio, Maldiojo. We see that in the Middle East and the Mediterranean, including Italy. Children are likely to be affected, and there's a constellation of GI symptoms, crying, fever of unknown origin. Right, so, Maldiocchio.
I don't remember the name, but there was an Egyptian one that we were speaking about.
Zar, Z-A-R.
Yeah.
The individual, almost in a dissociative state, is difficult to arouse, headbanging, and other bizarre behaviors. Right. Again, all are fair game on a shelf exam. Questions about culturally bound syndrome, and for the culturally bound syndrome, it's almost 100% of the time you're going to be asked the diagnostic label, right? Culturally sanctioned belief or behavior, 50-50. Sure, they can ask you the diagnostic label, but they could also ask what the next best step is. And unlike the culturally bound syndromes, the next best step for those culturally sanctioned beliefs is to do nothing, to reassure that it's completely normal. Questions about culturally bound syndromes or culturally sanctioned beliefs? Further observation on the skeleton K. We have about 4 minutes left.
I have a question. Let's pretend the fantasy element is gone, the magical thing is gone. Could you say that Violet and Ben is kind of like a Munchausen by proxy, maybe?
Oh, yeah.
Okay.
Yeah. Yeah, she's definitely poisoning. I mean,
Yeah.
Keeping him paralyzed. Yeah, sure. You probably should come up with a list of movies with factitious.
But do you think it's fictitious to him? Because is he aware?
He's aware. That's why he's trying to get help. That's why he's saying, help me. He's aware. No, clearly the patient there would be Violet. I keep on calling her Virginia. Violet, in keeping him sick. So it would be her factitious disorder by proxy.
Mm-hmm.
Right. Now, ultimately, though, as we deep dive this, why would we ultimately say this is not factitious disorder by proxy? Like, I'm focusing on Violet now.
If it's not fictitious for me.
Correct.
I think it would be some sort of personality disorder, right?
Maybe. But why not factitious? For factitious, what do we need to see?
Like proof?
Is it some sort of like external reward or gain or something? And she doesn't have that, or she's not getting that?
So we're very close. I reworded the question a little bit tricky. The fact is for factitious, say that quickly, for factitious, we need to see the absence of an external motivating factor, right? With any evidence of an external motivator, this is not factitious. So this looks factitious up until the point where we realize, oh, she just needs her body. She needs this guy's body, so she could, through root work and spells, have her husband get into a younger body. And that is an external, it may not be a realistic external incentive, but it is. So this is not factitious, right? It's actually malingering. Now, there is no such thing as malingering by proxy. I mean, that's exactly what this is, that is not a thing in the DSM, because malingering is no longer a thing in the DSM because it's a crime. It's no longer considered a mental disorder. So if malingering has been removed from the DSM in 2013 with the 5th revision, believe me, there's no such thing as malingering by proxy. Right? That's a crime. Final thoughts. Literally, I have 1 minute to go. Closing comment? All right, guys, I will be posting, if not tonight, first thing tomorrow, what next week's films are. And we'll take it from there.